Now, all organizations need to consider work-related stress and psychosocial risk as part of their safety and health strategy to reduce accidents and injuries at the workplace. Employers should be responsible for implementing plans to prevent or reduce psychosocial risks, enabling their employees to play their part and help create a healthy psychosocial work environment. Although many factors contribute to workers' mental health and well-being, there is increasing evidence that the workplace environment makes a very significant contribution. In a good psychosocial environment, work can be beneficial for workers' mental health, giving them a greater sense of social inclusion, identity, and status, opportunities for development, and increased confidence. Conversely, a poor psychosocial work environment can have significant negative effects on the workers' health. Now, there are 5 categories of health hazards in the workplace, namely physical, chemical, biological, ergonomics, and psychosocial. Now, stress, as we are faced with, is a common problem, falls under psychosocial. As workers spend 1/3 of their day at the office, workplace issues are one of the major contributors of depression. However, it is often overlooked, especially by employers. Employees may not recognize the symptoms, especially if they are suffering from a mild form of depression, such as burnout and dysphagia. The impact of mental health problems on the workers, their families, and society as a whole is immense and needs to be addressed. It is important to ensure the happiness and the well-being of workers and their families through initiatives to promote good mental health at the workplace. Mental health issues at the workplace should be given due attention, as the productivity of the staff of any organization depends on their state of mental health. Employers must be aware that the neglect of mental health and psychosocial factors at the workplace is not only detrimental to the individual worker, but also directly affects productivity, efficiency, and output of any organization. Employees' performance, frequent illness, absenteeism, accidents, and staff turnover are all affected by employees' mental health status. Issues related to mental health at the workplace can also have a direct impact on all the stakeholders of the workplace, including the employers, the customers, and the community in which the organization is located. No workplace is immune to mental disorders, and their impact in psychological, social, and economic terms is high. Mental health should no longer be ignored. On the contrary, it should be given adequate attention in relation to other business in any organization. Mental health among employees must not be overlooked when discussing occupational safety and health issues at the workplace. Workplace health promotion is essential, and it requires the combined efforts of the employers, the employees, and the government working together to improve the health and well-being of the people at work. The workplace directly influences the physical, the mental, economic, and social well-being of the workers, and in turn, the health of their families, communities, and society as a whole. The concept of workplace health promotion, or WHP, is becoming increasingly relevant as more private and public organizations recognize that future success in globalizing the marketplace can only be achieved with a healthy, qualified, and motivated workforce. The implementation of WHP can ensure a flexible and dynamic balance between customer expectations and organizational targets on the one hand, and employees' skills and health needs on the other, which can assist companies and work organizations to compete in the marketplace. For nations, the development of WHP will be a prerequisite for sustainable social and economic development. In conclusion, let me say here that, as we often know, health is wealth, and our mental health is as important as our physical health. Our physical and mental health must be balanced in order that we can stay physically and mentally healthy and strong. Let me state that mental health advocacy is a shared responsibility towards achieving the Malaysian National Health Agenda, in line with the National Recovery Plan and the Shared Prosperity Vision 2030. What we need is not only mental health care for the workplace, but for all. So let us all resolve to make this a reality. Thank you very much.
For that very illuminating opening remarks. Thank you, Tan Sri, for that opening remarks. De-stressing every now and then is very important, just like my lovely and peaceful surrounding here, which is thanks to the magic of the team from Big 2 Production. Next, yes, we would like to invite Sonia Abraham to deliver the keynote address. Sonia has been practicing at Azman Davidson & Co. since being called to the Malaysian Bar in 1997 and was made partner in 2005. She heads the firm's practice and employment law and industrial relations. Sonia is experienced in general litigation and arbitration for 10 years before specializing in employment law that greatly improved her capacity to advise clients from different fields and industries on employment matters. Let us give a warm welcome to Sonia Abraham as she delivers the keynote address.
Very good morning to Tan Sri Lee Lam Thai, our esteemed panelists and moderator, and to all participants. I would like to thank you all for joining us for today's talk about mental health in the workplace. It is indeed an honor for me to deliver the keynote address on this increasingly important issue, and I would like to thank the organizers for inviting me. Legislative changes are being seen throughout the world promoting the right to work-life balance. However, Malaysia's legal framework as yet does not even recognize the existence of this as a concept, let alone promote it. In a market-driven environment, the likely consequences of employers not acknowledging the need for a work-life balance are a loss of productivity in the workplace, frequent absenteeism, a high resignation rate as employees seek a change of environment to protect their mental health. Some economists have dubbed this as the Great Resignation, and difficulties in hiring and retaining talent. Hence, promoting mental health in the workplace is, if you will pardon the pun, a no-brainer. Laws generally reflect society's expectations. So if employers wait for the law to change before reacting, they may well find that society has already changed and they are left behind. Now, the Constitution of the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition, by the way, dates back to 1946. However, many of us today are still guilty of assuming that physical health is the only component of well-being. If someone were to fall down and break a bone, they are immediately rushed to the emergency room. No one would tell them to cope with it, try not to think about it, or that it is not a big deal. We place such high importance on maintaining good physical health. Sadly, less so when it comes to mental health. It is no secret that even today, there is a huge stigma against admitting mental health problems. There are many barriers that prevent people from reaching out for help. We are guilty of pushing ourselves to the point where everything else comes first before our mental well-being. However, truth be told, our mental health affects every area of our lives, be it our family relationships, friendships, and even our work life. For us to perform at our best at work, we have to understand that taking care of ourselves mentally is a priority. Before the COVID-19 pandemic, mental health was already a pressing and often unacknowledged workplace issue. However, almost 2 years since COVID-19 came into our lives, it is evident that the pandemic has caused these problems to escalate to a different level and had a huge impact on the mental health and well-being of all. During the crisis, many employees have struggled with grief at the loss of a loved one, isolation and loneliness through working remotely, general anxiety about the future, and burnout caused by long working hours or juggling work with other commitments such as childcare or caring for the elderly. A survey conducted by a local think tank, the Centre, revealed that 35 to 50% of Malaysians reported high levels of negative emotions, including depression, anxiety, and stress, during the movement control order in Malaysia. In fact, 42% of the participants of the survey admitted that their mental well-being in 2021 was worse off than it was in 2020. It also cannot be denied that most jobs have become more complex and the pace of an employee's day-to-day tasks have quickened tremendously. Employees are given instructions at all hours via email or WhatsApp and are often expected to respond immediately with quick turnaround deadlines. This tends to raise stress levels, and those giving the instructions would be well advised to consider the effect on the recipient. Whilst technology has helped us stay connected in a remote working environment, it has also impacted an employee's ability to disconnect from their work, making it difficult to create a distinction between home and work life. This is all the more so when the office is your dining table. Checking your emails while putting your kids to bed, reviewing a presentation at nearly midnight when you're finally getting to eat that dinner you made hours earlier. If increased flexibility has been a boon for employees in the pandemic era, it has also meant that we've had fewer and fewer chances to disconnect. I, for one, can attest to this. During the first movement control order in March 2020, it became very clear to me that the usual boundaries of time were simply disregarded. There was an assumption that everyone was available 24/7, and the ordinary boundaries of the workday and workplace suddenly disappeared. In a recent 2020 study conducted by KISI, a cloud-based access control and security platform on work-life balance and mental health, Kuala Lumpur ranked 4th for most overworked city amongst 50 cities involved in the survey. Kuala Lumpur also ranked 1st for longest hours worked and last for easy access to mental health care. These statistics are alarming, to say the least. Countries in Europe, such as Oslo and Berlin, were in top place for best work-life balance out of the 50 cities in the study. Unsurprisingly, cities said to be overworked were mainly located in Asia, with Hong Kong taking top spot and our neighbors down south, Singapore, coming in second. This could be due to the work culture across Asia, where many employees feel obliged to not switch off from work, and long working hours are the norm. It goes without saying that long working hours and the inability to disconnect from work go hand in hand with an employee's mental health. So what can employers do to combat the culture of overworking and unwillingness to switch off amongst Malaysian employees? To me personally, the first step is to actually acknowledge and reflect upon this unhealthy culture. Are there any practical measures a Malaysian employer can implement to create and promote a mentally healthier workforce? Are there restrictions that would prevent the implementation of these practical measures? As I mentioned before, at present, there is no specific legislation in Malaysia that compels Malaysian employers to oversee and ensure the well-being of an employee's mental health. Across the globe, however, the legal right for employees to disconnect from work is fast becoming the norm, especially in Europe. The right to disconnect refers to rules that say an employee should not be expected to field work calls, emails, or communication with their bosses outside of working hours. The idea of the right to disconnect is not something new, and this concept has actually been around for quite some time. In 2012, car maker Volkswagen in Germany blocked certain staff from accessing emails from the evening until the next morning to promote better work-life balance and mental health. The French government acknowledged tech-fueled burnout when it passed a law in 2016 giving employees a right to disconnect as part of a larger slew of reforms to the country's labor codes. This legislation allows employees to disconnect outside of working hours without suffering any detriment to their increments or promotions for doing so. Essentially, companies in France have to schedule for non-critical emails to be sent at 8 a.m. on the next working day, and emails sent outside office hours usually have to state that no immediate response is expected. It appears that the legal right to disconnect has gained traction in many parts of the world since the beginning of the pandemic, as vast portions of the workforce worked away from the office and in their own homes. Ireland was among the first countries to introduce a legislation specifically centering around the new work from home era. Ireland's post-work-life balance and mental health Ireland's post-COVID-19 rules on the right to disconnect are meant to preserve work-life balance and mental health and are aimed at protecting all employees, including those who work remotely and flexibly. More recently, the Portuguese parliament attracted headlines around the world after it banned bosses from contacting their employees outside of working hours. Under these new laws, Portuguese employers will now face the sanction of a fine up to 9,600 euros if they text message, phone, or email their employees when they are off the clock. So the right to disconnect seemed to be an essential move to strengthen the boundaries needed for a good work-life balance and promote better mental health in the workplace. In essence, it suggests that there should be a clear boundary between the hours in a day when an employer's authority prevails and the hours when a worker's autonomy takes over. In theory, the right to disconnect is intended to preserve work-life balance and protect employees. But in practice, does it always benefit employees? For example, can an employee's right to disconnect coexist with flexible working hours? The downside of the right to disconnect is that the employer will require employees to be always on during office hours. This may reduce flexibility to, say, working mothers who may prefer to have some time off to attend to their children during office hours and catch up with their work after their children go to bed. Another possible scenario that could arise is that the imposition of a right to disconnect will inadvertently introduce a mandatory finish time for employees to complete tasks. So this may increase the pressure on employees to meet deadlines within working hours. Further, it would be a challenge for the right to disconnect to work across different time zones where different laws apply. So is it even possible to enshrine the right to disconnect in a new post-pandemic remote working world? What are the alternative solutions employers can implement to improve mental health in the workplace? How do employers move away from the overburden and mental burnout we are trying to avoid? Despite the undeniable fact that the COVID-19 pandemic has presented new and unique challenges to everyone, it is crucial that policymakers and employers across the globe step up their efforts in combating the hidden pandemic of poor mental health in the workplace. I, for one, strongly believe that the right to disconnect is just the tip of the iceberg when it comes to addressing mental health in the workplace. Instead of waiting for legislative intervention, which inevitably tends to be heavy-handed, employers would be well advised to find creative ways to address mental health issues within their organizations. It goes without saying that employers that prioritize human wellness, both physical and mental, will gain a significant competitive advantage in terms of talent retention and long-term value creation. After all, good employers and managers will more likely prosper than insensitive ones. One of the positives that has come out of this pandemic is the increased awareness of mental health in the workplace as something that needs to be addressed urgently. Perhaps the surest sign of success would be when we reach a stage when nobody feels the need to specifically address it because it has become a normal aspect of the working environment. On that note, I look forward to hearing from our very esteemed panel of speakers, and I wish you all a very insightful and meaningful discussion today. Thank you.
Thank you, Sonia. That was very enlightening. And yeah, hearing about 35% to 50% of Malaysians who are stressed out, I think that is a worrying number. So moving on, ladies and gentlemen, let me introduce to you Shilda Ismail, who will be the moderator in our panel of discussion on mental health in the workplace. Shilda has more than 19 years experience in the media, news, current affairs, and in the broadcasting industry. Mental health is also a subject that is close to her heart as she was diagnosed with post-traumatic stress disorder or PTSD. And as a result of this, she fully comprehends the importance of mental wellness and the impact of it on one's life and professional career. Shilda is currently the senior executive producer for her own talk show called Kini Halal in Malaysia Kini. Over to you, Shilda, for the remainder of the session.
Hi, good morning. Thank you so much, Tan Sri Lilangtai, Sonia Abraham, and also Stephen. I really love your background. I wish I had my own background. Okay, as I can understand from the organizer, we have more than 100 participants and viewers attending today's Zoom. Okay, I'm Shilda Ismail. I'm the senior executive producer of Kini Halal for Malaysia Kini. I was diagnosed post-traumatic stress disorder. I'm an advocate of neuroplasticity and also cognitive behavior therapy. I shall be moderating for today's webinar, Mental Health at Workplace. There's also a Q&A session at the end of today's forum. Feel free to type your questions and submit them via Zoom Q&A box. All right, as uncertainty, disruption, and fear from the pandemic takes its toll on millions of workers and professionals around the world, including Malaysia, support is needed. Empathy is needed. It was reported that depression predicted to a major mental health problem among Malaysians by 2020, 2021, as more people are expected to experience increased stress due to work and family pressure. Well, the mental health issues in workplace must be addressed promptly with due attention. We have a esteemed guest for today. First of all, let me introduce Professor Adjunct Dr. Andrew Mohanraj Chandrasekaran, President of Malaysian Mental Health Association and Adjunct Professor of Psychiatry at Taylor's University Medical School, Malaysia. Hello, Prof. How are you?
Sorry. Very well. I'm very well. Thank you. Thank you.
Okay. Have your coffee?
I'm still having another cup, one cup after another.
Okay, cheers to that. Okay, let's have our next panelist here. We have Dr. Tiffanie Ong, Cognitive Psychologist and Chief Operating Officer of Naluri. Hello, Doctor.
Hey, morning.
Morning. And next we have Dato Aliyah Karen, Social Activist Trainer and Global Speaker. Dato.
Morning, Shida. Morning,
Hi.
everyone.
Hi. And we have also Ranjitha Malar, Head of Recruitment of Big Two Bazaar.
Hi, good morning, everyone.
Hello.
Morning. Hello. Okay, let's start the conversation for today. So we can start with Professor Dr. Andrew. Dato, perhaps you can tell us the current scenarios in mental health amongst professionals in Malaysia. Dato.
Thank you very much. Thank you. Really, I really don't know where to begin because
Yeah.
I'm a bit overwhelmed this morning listening to both Tan Sri Lilamthai and Sonia Abraham. They've really covered so much, such comprehensive presentation there. And, all the points that I made out here, wrote it out just 10 minutes ago, it's all been covered. So I don't know where to start. Nevertheless, I'll still add on to what they have said. And you spoke about what is the, your question was, what is the current scenario among mental health professionals,
Yeah.
right? And as you know, that Malaysian Mental Health Association, of which I'm the president, has been around for quite a long time. And during the pandemic, we did start our own helplines and moved on to offering additional counseling and psychology services mainly. And in that process, we found out that there was a tremendous increase in of course, the number of calls, the number of clients reaching out for help, but the percentage of professionals was very, very significant in this group. And surprisingly also, and perhaps not so surprisingly, also some of the reasons that were cited by these professionals, for reaching out to us and exhibiting symptoms of stress, depression, and anxiety related to the same reasons that others, even in the B40 category, were concerned about. And all this, as covered by Tan Sri Lilamthai just now and Sonia as well, it revolved around uncertainty, financial issues, uncertainty of job security. Even though some of them had jobs, they were just wondering what's going to happen in future. There was also these issues, and very clearly, while they held on to the job, clearly the companies involved were moving towards task shifting. There were, some of the tasks that were originally done by, a couple of people were now suddenly being done, and they've just discovered that it actually can be done by one person. And where travel was seen to be essential, it's no longer essential. It can still be done from home. So working from home also had its own kind of challenges for people because they were not supervised adequately. And, we also discovered, personally, I discovered from the feedback that I got from many of the line managers that they found they had to pick up a new skill, and that is how to learn how to read between the lines in an email. Because they really didn't know how the employee was feeling at that time. But then based on the crypt manner in which the email was written, or, there's no more kind regards and just an initial after that. So they started interpreting this like what could have been the mental health status of that person. And as Sonia pointed out just now, also, they also started looking at the time when the email was sent and what did this and how did it reflect on the mental state of the employee as well. So all this plus, of course, the fear, I think, although we human beings have always gone through a lot of innovative process to bring us to where we are here today, and including the industrial revolution that mankind went through to what we are today. Nevertheless, there was also this fear of, artificial intelligence, automation, and particularly task shifting became a very serious threat to redundancy as well. So, and all this definitely, as I mentioned, caused a great deal of anxiety and depression and stress, which led to having an impact on interpersonal relationships and, how parents treated their children and family, and the question of respect came into the picture in our traditional society where a breadwinner has a certain level of respect and dignity, and suddenly during the MCO, all those lines had been blurred, and, that had a major impact on the relationship between husband and wife as well. And I think this is the kind of changes that we saw, which told us statistically that there was no real difference in the anxiety, stress, and depression levels of the professionals and non-professionals as well. And of course, of late, we have been receiving calls and people reaching out to us for having anxiety to get back to work. you know, and because they've been used to working from home. And this is also because of, as what Sonia had pointed out just now, there's been no clear lines as to household chores and, you know, doing work, and sometimes to the extent that people didn't even bother how they looked, they just worked in their pajamas. And sometimes during Zoom calls, you could see somebody walking across with a cup of tea, or, you know, running after a child or something like that. So it just blurred everything as well. And the fear of the contagion. Now there are many people who are fearing whether they should go back to work because they might just, you know, get contaminated, get the virus, contract the COVID at the workplace as well. So this has really taken a big toll, and particularly I think in some industries which are so used to sitting around the table and exchanging ideas, like your advertising industry, for example, where all those fantastic ideas come out through sitting around a table and arguing and harnessing a certain, you know, concept, that has gone. So that is going to affect productivity as well, you know, and these are things. And of course, from my own industry, and I'm sure Dr. Tiffanie Ong will agree with me here, you know, we are so used to looking and interacting with the client directly, and, you know, not only verbal, but non-verbal cues as well is all taken into consideration before we make an assessment and intervention. Now, how do we adapt in this environment where we have to use Zoom? So, you know, these are great challenges that I see that in the workplace.
You're on mute.
The risk, the technological stressor that's causing us, you know, this Zoom. Okay, Dr. Tiffanie, perhaps you can tell us what is Naluri is all about, and also why do you think that a companies or organization acknowledging stress, burnout, and overwhelm manages, and what happens when mental health is compromised at the workplace, Doctor?
Thanks a lot. So very, very great to be here again this morning. And I think I echo what Dr. Andrew mentioned. I think all the good points that I also have listed here in the past, well, now half an hour have already been mentioned. But I think maybe I have a few more unique points, and maybe I start with number one, what is Naluri all about? So Naluri, we are a digital app company. And we basically, well, I guess our reason for existence is really to connect people with a multidisciplinary team of healthcare professionals that can help them coach them in order to achieve their health goals. It is a nice reflection when I think about where Naluri was 2-3 years ago when we started. And we would reach out to employers trying to get them to appreciate the importance of thinking about an individual's health from a holistic perspective, right? So physical health is just as important as mental health. But oftentimes what employers struggle with is, I cannot quantify the impact of mental health, right? I don't know what the dollar value impact that is for me. I can only tell you the dollar impact of someone with a physical health condition, right? So if they needed to go for a heart surgery, right? If they were diabetes, or if they had hypertension, like what is the cost of their medication, right? So that they could understand. So then when Naluri initially started, when we wanted to reach out, or rather when we reached out to employers to kind of propose how we can support their employees, we often had to go in with the physical health angle. But then once the employees came onto our platform, we connected them with psychologists and counselors to then help address what are some of the underlying kind of motivation that is required for an individual to get healthy. Because again, we all know what it takes for us to be healthy. And yet Malaysia as a nation is getting more and more unhealthy every year. So when we initially started this conversation, like we had to use physical health as our Trojan horse just to make mental health a priority. But it's so good to see, and I think as some of our speakers said earlier as well, the one silver lining of COVID-19 has been that now so many more employers are prioritizing their employees' mental well-being. In fact, if I look at just in terms of the breadth of the clients that we serve, we started with 100% of clients just focusing on chronic physical conditions. And today, over 90% of our client base have a mental health component in all the employee assistance programs that they are running with us. So I think that is, that is a tremendous kind of development in terms of appreciation of the importance of mental health. Maybe I just kind of add on, I echo again what everyone has said so far, but I think the one element that I also wanted to highlight is the importance of seeing mental health as something that is on a continuum. So I think Tan Sri spoke a little bit about how mental disorders need to be prioritized within an organization. That is true. But I think at the same time, organizations need to prioritize those individuals who are still healthy, or rather those who are still in the green zone. Right. So what we do a lot within Naluri is that we try to get as many people as possible to complete the DAS21 survey. So that's the depression, anxiety, and stress scale. And then based on that, you would find out whether you are within the normal range, mild range, moderate, or severe or extremely severe range. Now, a lot of attention now is kind of now being directed to addressing the needs of those within the severe and extremely severe range, right? I think like what Dr. Andrew mentioned around extending the types of services that's being provided. So providing care lines, right? Providing remote therapy. So all that caters to those in the red or dark orange zones. But actually a lot can also be done in helping those who are in the green and yellow zones. Because if those individuals are not taken care of, then eventually they will have a higher risk of then deteriorating further. And then at some point, they may fluctuate to the other end of the mental health spectrum in developing serious conditions. Yeah. So I think for employers, it's also worth thinking about things like the importance of resilience, the importance of kind of problem-solving skills, so that employees are better equipped to then kind of know what are some of the triggers that they should look out for. And then in the event of those triggers, what are some of the things that they can do? Because I think as Tan Sri also mentioned earlier, mental well-being has a direct impact on work productivity, right? Especially when it comes to working from home now, the incidence of presentism is so much more, right? In the past, it's maybe a little bit more skewed towards absenteeism, and then you can't measure presentism. You just know whether or not a person is physically at the office. But today, it's so easy for us just to go online, right? I've heard all kinds of hacks about how you can remain online even if you're not in front of your computer, right? And more people are doing that, right? Just to give the illusion of being at work. But in reality, their minds are not there, right? They are either looking at their running child or their crying baby, as I am sometimes, admittedly, I do that too. And then with that, I think comes the need for employers to kind of rethink about how they support employees, right? And it's not as simple as, okay, here is a coverage for you. If you want to get help, here are some numbers. We have paid for it. Like, go call and speak to some professionals, right? I think employers need to be a lot more intentional about how they kind of pick up on the cues that are not so obvious. Because I think like what Dr. Andrew mentioned as well, like we are all trained, right, as mental health professionals or as human beings in general, to interact with kind of all the body language cues available. But right now, all you see is like head and shoulders and a little bit of my hands. Like that is not enough for you to truly understand what someone is going through.
Okay, thank you so much, Dr. Tiffanie. Moving on with Dato Aliyah, perhaps you can tell us Dr. Dato Aliyah Karen, she is the social activist, a trainer, and a global speaker. How has it been, Dato? And perhaps you can tell what are the tips to create a great culture for a remote workforce. And as we can understand, most of us are in the hybrid mode or in the work from home or work from everywhere environment. Dato.
Thank you, Shida. Yes, as a speaker, I have been speaking quite a bit, and I'm quite glad to be on this platform, also picking up a lot of necessities, especially where mental health is concerned, and I've been enjoying what everyone has been saying. I'm also the founder of Yayasan Health on World, which advocates mental health. So therefore, it's also a support system to both Naluri and also to the Mental Health Association out there. I think we need more advocates at this moment. We have specialists, we need more advocates, we need more people to come out and talk about this openly, courageously, and have open, honest conversations. And that's something that I've been advocating and encouraging, especially to the many organizations and the people, or the public rather, when I have sessions and I speak to them. One thing that I would encourage everyone is to have open, honest conversations about mental health, because I think 4 years ago, 3 years ago, even 2 years ago, probably it was a very taboo subject. And people related mental health to you not being right, in the right frame of mind. You have something wrong with you. When you have mental health, means you should land in a hospital, a mental hospital like Tanjung Rambutan. People associated to that. And what COVID did was something, giving all of us some sort of mental anxiety, which I think we all need to admit that even if you are at whatever level, at whatever position, at whatever state of mind, no matter how strong you were, we were all disturbed with what has happened the past 18 months. The difference is some of us were able to come out of it. Some of us got assistance. Some of us had a lot of support from organizations. Some of us employers knew where to reach out to help some employees, whereas some just did not know how to move on and took a lot of burden on themselves, leading to this very high rate of depression, anxiety, people going into distress, so much so that even the suicide rate went up tremendously, especially among youngsters. And as what Dato Andrew mentioned just now, earlier, he said, he talked about the numbers and professionals that were also into this category where we found that they were needing help. So I think basically it's very safe to say that everyone had some form of mental anxiety, mental stress, or mental tension in that sense, and we cannot deny it. So the question now, when we talk about culture in an organization, I think Sonia covered quite a lot about the culture in an organization and the culture even in other countries, right? So let's put other countries aside first, and let's talk about the culture in our organizations here, right back in Malaysia. During a little bit of a story here is that during the first phase, I had actually quit my job, and then I'm currently doing a Ph.D, a study on something. And during that first few months, I had from wanting to do nothing to having to do a lot of employee-employer engagements, especially for pharma companies, because my background is in medical, related and associated to medical organizations, right? So naturally, going in, I heard firsthand a lot of problems and issues that were raised, a lot of concerns, I would say, questions, what's going to happen. Employers were saying they don't know what's going to happen, and everyone's looking at the bottom line. Can we hit our KPIs? Are we going to make money? Those kind of things. And employees were concerned, obviously, like, will I lose my job? Will I be demoted? Will I be let go? What's going to happen? We're not coming back to work. So where's the support? So there was just too many questions. And one of the things that I had realized after a few companies, having to discuss with a few companies, was actually having these open, honest conversations, where I'm hoping that in 2021, going into 2022, the culture in an organization should change, right? It should change and add on this value of having a flat hierarchy instead of the boss says and the employees listen. There should be open, everyone should have to have open, honest conversations, courageous conversations of actually admitting how they actually feel. So it's not just about the job, because in an organization, all along from the time that we started work right up to last year, we always, when we talk about, when we go into the office, it's 90% work, right? So you're only talking something off work, probably during the lunch break or tea break. Other than that, even then, you probably bring your work into those conversations. So what is culture in an organization? Basically, it's your beliefs. What is the belief in an organization? What are your shared values? What is the goals? What are the objectives? What are the practices, right? And the habits that have been going on in an organization. So when you came into a remote working space now, where we are all talking about working from home, or even 50%, 30% working from home, these changes, are they there, or did we go back to the previous culture, or have we changed? In the first place, is it possible to hold on to the existing cultures that you used to have? Right? So these shared values. For example, if your culture was every Thursday everybody came in batik, I know companies who do that, right? So now that you are on a remote working at home, do you actually wear a batik shirt and go online and speak to people, right? At 4 o'clock on Wednesdays, we used to have tea breaks, sembang, teh tarik, right? So is this still going on at 4 o'clock? So my question is, why not? Right? Because these are good values. This is what brought people together in the first place. This is what gave them that ease, no tension, everyone's on the same page, let's just sembang, or let's just chit chat, as you call it. So the good values, obviously, we want them remained. We do not want change. We want people to say it's okay to have this culture, it's okay to work remotely without losing that sense like I am alone at home. I do not have support at home. It's lonely at home. I miss my friends. I miss my colleagues, right? I miss my room. I miss the gym downstairs. I miss the coffee shop. I miss the makcik who sells me lunch or who provides me breakfast. I miss the tea lady's coffee. So these are the things that has happened. Now we need to adapt to those. So in the event we're talking about the culture change, we only want to encourage the changes that were not really helping us, right? In that sense that this remote working, maybe the change is now I have to prepare my own laptop, I have to prepare my own, back end, right, of to support the place that I work in. I like the word some of everyone used, including I think Dr. Tiffanie used as well, boundaries, right? So this is my encouragement to everybody to say, when you're working at home remotely, realize that you need to have some boundaries, okay? Because there is now this thing of husband working together, and where is everyone working at home anyway, right? On the dining table, most places. Why? Because the room is used by someone, the kids are also online, right? And then you've got the little one running around, and husband and wife are both online. I know of a personal friend who has to go to the bathroom, thankfully the bathroom quite big enough, to actually make some conversations or calls and bring the laptop in, because everybody is occupying every space in the house. So this culture that we are talking about is something that we need to learn to adapt. So my take on this is this: start injecting good culture, good beliefs, good systems, good things that would bring employees together without losing that sentiment that I'm no longer working. There's so much that can be done. I know when we work in remote, there's good and there's bad. Now let's take the good, for example. The good part about working remote for organizations is that you save a lot of time. You don't need to travel. You're not stuck in the jam. The minute we had, I think it was 1st of October onwards, everyone started to go back to work. People were not talking about, hey, it's nice to go back to work. Everybody was saying, the jam is bad, right? And everyone, right? So you see that there are good things and there are not very, very good things, obviously. But the other thing is people saved a lot of money. People did not hire, employers were not hiring new employees. Some even downsized the office, the organization, the structure, everything, basically because they wanted to save some funds. Dato Andrew mentioned just now, people started to realize a lot of things could actually be done at home, right? And 4 people's job actually done by 1. Believe me, it's been happening even with me, right? So previously you got a PA, you got a secretary, you got this, you got that. Suddenly you're at home working, you're not going to invite your PA and everybody to come to your house. So you do everything on your own. So it is possible. So I think when we talk about the culture, let's stick to the culture, the values, the beliefs, the systems, the habits that have contributed to what was good previously, and look at the others and say how has it benefited, whether it's safe. Today we celebrate small wins. Now, one thing that I want to ensure that everybody has in your culture system and your beliefs is checking in on each other, right? Previously we didn't bother to do so. Today, one of the things that I'm encouraging is you all have group WhatsApps. So check in on each other, not about work. We tend to check in, how's the project, how's the program, how's the progress, etc. I'm talking about checking in, asking, hey, hi Tiffanie, how are you? And before Tiffanie can answer and say, I'm fine, we move on. No. When we say, how are you, ask the question again. No, really, seriously, how are you? And Tiffanie probably take a step back, and Dr. Tiffanie might say, did she ask me that again? Okay, how am I? Because we're so used to this that people say, how are you? We say, fine, move on. Or yes, thank you, because that's the culture that we have been brought up with. People ask, how are you? We say, fine, thank you, and then that's it. So today, if you can take one extra step in your organization to actually ask somebody twice, how are you? How are you doing? How are you coping? I think that's one good step and one really, really beautiful culture that should be inculcated into your organization. continue with the values and, you know, small wins, celebrating small wins, even over a cup of coffee, over a cup of tea, whatever it is, to have that to say, good job, well done, rather than WhatsApp. It is possible to meet face to face now, but when you're working at home, don't forget, you can, when you turn on your computers, it's not all about work, right? So I think we also want to celebrate small wins. And today we have a lot of apps, right? We have Kazoo, we have Monday.com, we have Assembly, we have Go Game. So many of this that helps us with our online presence. So these are the little things that the organizations can adopt and learn to adapt, and then get people on the same page, make small changes towards the culture, where the culture is no longer the mission, vision, objective, which previously, I'm not saying it's not important, but I'm saying add on little things that balances up the employee-employer engagement, adding value to your mental health, because these things make us happy, right? The fact that you are playing a kazoo for, 2 minutes or something, answering some questions, makes you happy. The results that you get. Somebody saying, let's have a coffee at 10:15 and let's have a chat with 2 biscuits makes us happy. I realized when you asked the question just now to Dr. Andrew, how are you this morning? Have you had your coffee? The coffee mug went up, and both your coffee mugs went up with a smile. That itself made us smile. So little things that do matter, right? You may not realize it, but little things do matter. So let's try and inject some good values into the culture, make some small changes for the benefit of everyone's mental stability, mental health. Don't forget the emotional resilience as well, right? Because it helps us emotionally blend in with the organization, with the people we work with, and reach out and check in on somebody. So I think those are the little things that you can, that I would suggest that you add in. Thanks, Ishida.
Okay, thank you so much, Dato. And I so agree with your Sembang Teh Tarik Malaysian culture. So we also can just include the roti canai and also the keropok, leko and culture. So moving on from Malaysian culture, we move on to the human resource angle. Okay, we have Ranjitha here. Okay, Ranjitha, you are the head of recruitment for Big Two Bazaar, right? Okay, perhaps you can tell us, from a perspective from your company. Now, what do you think of employees' dedication to providing a healthy and safe working culture? Okay, not talking about working culture lah. Okay, talking about how is it with Big Two Bazaar? How can also HR help with mental health? I mean, as I am also an employee. Whenever I speak to the HR, they always say, they are not a trained doctor, they are not a trained psychologist or psychiatrist. They say, oh, okay, can, and they write it down and that's it. Okay, what are the HR's role in mental health awareness? Ranjitha.
Thank you, Shida. Hi, everyone. Right.
Hi.
I like when Dr. Aliyah was speaking about positive culture and doing small things in the organization. I truly agree with that, because that is the most important element that we should have as employer in any organizations. So because why? Because HR department it's one of the departments where every employee is the first place where every employee will go to seek for support, assistance, to speak with. So as a HR person, the most important role is the HR should provide an open and friendly environment, organizations, so that employee feels safe for them to discuss about the issues and concerns that they have within them, or it can be personal, or it can be anything relating to workforce. So that's the first thing that HR has to do. Apart from that, right, looking at the policies, what is the benefits around? Can I look into medical benefit? Is that enough? Is that insurance coverage? Is that enough? Is there any wellness benefits that we can provide to the employees so that they can make use of it? For example, inviting speakers to create awareness of mental health. Collaborating with the NGOs, organization. We have a lot of NGOs outside who's providing free talks, free campaigns about mental health. Maybe the employee can take the first steps, especially the HR persons, to seek help and ask them whether they can collaborate with this kind of organizations so that they can bring in speakers to the organization and then speaks about what is mental health about, create awareness. Yes, Sheena, I agree with you, not everybody, the HR is not an expert. I agree with you totally, even I'm not an expert, but I should carry a responsibility to upskill myself as a HR person, what I can do for our people in the organization, build up the positive culture in the organizations. That is very important. When you have creating a part for an employees, a comfortable space where they can come to you and speak, I would say that is a successful thing that you have done. Because not every employee will come to you and say, hey, I have this problem, I have that.
Yeah.
Nobody will do that. Like before COVID, we have this thing that the HR can walk the floor, say hi to everybody, say good morning. Maybe they can locate a sign or trigger. Suddenly, employer is working. He was very productive in the past 2 years. Suddenly, his productivity falls. There's a signs where a HR can look to. Go and ask the person, what is happening? Are you good? How are you doing today? This is a small talk that they can create. But currently now everybody's starting to work remotely, for example, now during COVID. So how do we create this culture? We still can uphold the same thing. We used to walk the floor. Why not we just do a virtual meet every week? Like how Dato Aliyah said, do what you have done before. Previously physically, now let's do visually, right? Let's do virtual talk. Morning breaks, let's say, for example, let's have a morning high. But we create a program virtually. Every morning, every Monday, everybody on your virtual come in and then say hi to us. You want to see how we are doing. Some people are looking at if the employee cares for me or not. That's one thing. It's my boss asked me, how am I doing today? That is very important for some employees who's facing burnout or stressful situation in an organization. So this is a small thing that HR, even a manager should have triggered this kind of signs, or they have to be naturally has to be in them. This thing, how are you doing? This is a natural thing, has to come from a HR person actually. So in Victor Bazaar, what we did was, of course, we just came back to office, but not all of us. We still have a few number of us working from home. But how we help each other is actually we are practicing for positive work culture here. So everybody, the togetherness is very important for us in Victor Bazaar. We treat everybody equally. We even practice open door concept, which is manager or whoever you are, subordinates, co-workers, everybody sits together. That is open culture. People can see each other. If anything goes wrong, you can always come and talk to me. No matter, you can go to the HR or you can go to the manager. So normally what happened was the employee will go to the manager first. So after that, the manager has to have this kind of 5-minute chat with a person. That is good enough. 5 minutes in a day. If a person coming to you means he has something to tell you, spend 5 minutes. Don't talk about work, as Dato Aliyah says. Talk about personally, ask personal questions. He might open up or she might open up. You don't know. So if manager has think that he need an HR support, then the HR can walk in and help the employee see in another angle what they can help and all this stuff. But I would say that collaborating with the NGO for current situations, employees should collaborate with a lot of NGOs, invite speaker, create mental health awareness campaign in an organization so that he can provide awareness, knowledge, not even to the HR person, to everybody in the organization. At least they can understand what is mental health is about, where they can seek help. The HR's next important thing that they can do is list out all this NGO bodies number. If you can't pay expensive fee for professionals, if you can help them to connect to NGOs to help them, then the HR should step in doing. List down a number, put in a notice board, given expiration codes every day, send an email, good expiration codes, don't send about work, just say anything good today, that probably help people in our organization to create that togetherness, to create the positive culture in organizations.
Okay, thank you so much, Ranjitha. I do agree that we need to have a 5-minute non-office talk, or perhaps we can gossip about the boss. That 5-minute gossip with the boss that could vent out, some of our suppressed feelings. Betul tak, Dato? Okay, Dato, on a serious note, yeah, I would like to ask you a question, with regards to legal and also policy, legal framework and also policies in Malaysia. Do you think our policies and legal frameworks of mental health and well-being in Malaysia, where do we stand? How is it compared to developed countries such as in UK, Dato?
Okay. How many minutes do I have? Because it's very dangerous giving me the mic. I'll just go on and on speaking.
I'm here for you to listen to you. No worries.
I was really interested in what Ms. Sonia Abraham mentioned just now about not having the legislative mechanisms, in our country and in many countries in the world for that matter, to ensure that workplace mental health is really looked into, not as just as a mere gesture, but as an obligation. And if you look at other countries in the world, and you have asked me this question about comparing with other countries, they do have some form of a body, a personality or a position that actually looks into mental health, either as an ombudsman body, you have a mental health commissioner. In many countries, if you look at in Australia, there are 3 states in South Australia, in Queensland and in Western Australia, where they have actually ministers for mental health. So is the case in Scotland, in Ireland and in Wales and some of the Scandinavian countries as well. Now with that kind of leadership, there was also a need to look into mental health needs, how to implement certain structures and policies, make it mandatory and an obligation by the employer. So this is one thing that is seriously lacking, and this, I believe, will also lead to the necessary legislative mechanisms in process. So until that happens, then it is largely self-regulated, as our previous speakers have also spoken about. Now, I think in that context, we should also then start thinking about company policies, which we must understand. First of all, the whole industry needs to understand that there is a strong link between mental health and productivity. There are studies to show that there's a great loss. In 2019, Relate had mentioned Relate is a local NGO think tank that has said it came out with a statement, with a finding that in the year 2019 alone, the loss of productivity was about $24 billion US. And that's due to depression and anxiety, mainly in the workplace. And we know that there are enough international statistics. I will not go into that now, but the fact is there is a strong link here. And industry will only understand dollars and cents. And therefore, there has to be a great introspection now to know and to feel that if you do not look after your employees, then you're going to suffer ultimately, and that feeling must be real. And that can only come through a legislative process. And I strongly emphasize this, and I identify with what Sonia had mentioned just now, particularly also because this event is a parallel event for the Employer Law Conference 2021. And therefore, I think legislation plays an important role. In the meanwhile, I think companies might need help to formulate policies like this, because they do it not intentionally, but because they do not have a proper understanding of mental health. So issues of hiring people or firing for that matter, and whether the terms of reference of the job or the job description actually fits into the capability of the employees. And often the employees are also to be blamed. I found out that many of them just over-declare their capabilities and their abilities to do things just to get the job. And once they get the job, and then there's a great deal of disappointment that they do not fit into that job description as well. So this is really important to understand this. And very quickly, if you don't mind, I'll just give you one example to illustrate this. I had a client who was doing very well. I mean, he was just really, I forget what was his position, but he was really very high up in a multinational company in Kuala Lumpur. And he came to see me one day because I mean he had symptoms of depression, and in fact he was also suicidal. And I found out there was a major life event that had happened, and that life event was a promotion, not the demotion, but he got promoted. In fact, he was promoted so high up, the one step higher, where it enabled him to have a car and a driver, and the driver could drop off the kids in school. And before he had to drop them off. And it was a different lifestyle altogether, which also involved a great deal of travel. But because it involved a great deal of travel, and he just couldn't take that. So his promotion led him into being depressed. But he couldn't tell this to his workplace, his colleagues and his superiors. Like, you have given me a promotion, you've given me more money, and yet this has caused me to feel this way. So clearly there was no declaration of his capabilities to his colleagues. There was no honest discussion there. So I think this is also important. I'm sure that Aliyah would have come across many such situations like this, as well as Ranjitha as well in HR. So I think that is also there. And we might need to also understand the need for a legal declaration of the past psychiatric history or mental health history of a client when they joined the company. These all need actually legislative measures. But in the meanwhile, how to normalize this? When you talk about normalizing mental health in a workplace, it's all very nicely, it's nice to talk about it, say it, but it can't be done so easily, unless, of course, you invite people like me to come to your organization and talk about it every week and bombard you on mental health messages and things like that. But when in reality most companies do not cover mental health, I mean, forget about the insurance industry. We are still there making baby steps there. There are 3 major industries in the insurance companies that are trying to do their best and cover, but the coverage is still not wide enough. But companies, while they have panel clinics, and you can go to any of these panel clinics and get treated for cough, cold, and whatever, and submit the invoice to Ranjitha's department and say, okay, maybe you reimburse this or into the card or whatever. If they were to see Dr. Tiffanie, for example, and how is the company going to handle that? You have not normalized it and said it's perfectly all right. You can see, and you can claim. Or even make sure that your panel clinics also have got psychological support services. Things like that has to come from within for us to make any strong, definite changes in this. And I do believe that ultimately, like what Sonia said, legislative changes is the real, true answer for this. And just one final point before I give space to the other speakers, who are probably wondering, like, when is this guy going to stop speaking? Is this, in my practice and my knowledge, I've come across so many senior executives, very senior executives, multinational companies. I mean, these people are all, really out there doing so well from the eyes of the public, right? But they are actually people with anxiety and depression, many of them. And that does not mean, I mean, if you look at the productivity, they're producing more work than others, anybody without a depression or anxiety, really. They might, part of it may appear in their personality to be irritable or being, the sort that are very tough bosses, demanding work done by their subordinates. But they themselves actually have anxiety and depression. But they can't come out and say that, and nobody will believe them in the first place and say, how come you have depression and anxiety and struggling with this, but you're such a super worker, So this can happen to anyone. And I think the time has come to normalize this conversation, but that can only happen with legislative changes. Thank you very much.
Okay, thank you so much, Dato. I would love to welcome you to Malaysia Kini. We have all the stress reporters, everyday politics and also elections. All right, moving on with that, with Dr. Tiffanie. Okay, this is more on the technical side. The methods and modalities for employees to practice mental health whilst working. Doctor.
I guess this question relates to how, employees can protect their mental health, while working. And I think with that, I want to echo a lot of what Dato Aliyah mentioned in terms of how it is important for us, especially right now, right? Because I guess let's just assume that this hybrid or flexible way of working is here to stay. in order for us to protect our mental health, I guess if you look back at what are some of the main reasons why our mental health has been deteriorating, right? And then of course there is things like, oh, work-life balance is impacted, and I think some of these stuff that has been mentioned.
Yeah.
But I think what has not been mentioned is the impact of not forming that type of relationship with your fellow co-workers. Because sense of belonging at our workplace is very important, right? We think about in one day we have 24 hours. How many hours in a day are we spending at work? A lot, I think, if I take a guess, right? Especially even more so now because of how, you know, we try to organize our life around our work, right? So we end up kind of working sometimes throughout the day, but then in smaller chunks. And then with that comes this need for you to feel that you are part of the organization that you're with. But what we have observed in Naluri, and this is kind of from a personal perspective as well, what I have noticed is that new joiners who we onboarded in the past year and a half tend to have if I call it a weaker bond with the entire company, because I realized that all conversations are transactional in nature, right? In the past, if I'm sharing a space with you, right, sharing a table or you know, just kind of being in the same open space as you, I actually find out a lot of little things or little nuances about my colleagues that are not explicitly said, right? Like I find out preferences in terms of what they like to eat. I find out little things about what they did over the weekend, right? Because they are conversing with someone else, right? But all these things are completely lost in a virtual environment, because then you find yourself in this position where you feel the need to organize a specific time slot. And what happens with a lot of these virtual meetings is that you tend to start the conversation with, oh, this is the agenda for the call today, versus having an open conversation where you actually get to know your colleagues in a deeper manner. So I think one of the things that is key in terms of protecting employees' mental health, that what we can do for ourselves is to ensure that we don't lose that social element, which oftentimes gives us a deeper sense of fulfillment when it comes to our work. Secondly, of course, is then the need to practice self-care, right? And I think this is a term that is oversaid, right? And everyone, you know, has seen this image where we say, oh, you need to put the oxygen mask on yourself first before you cater for others, right? I think this has been said and done a lot of times, but it's a lot harder in reality than it is just kind of advising it. But what I would say is a very useful tip is to start your day by prioritizing what amounts of time you want to dedicate for yourself first. Because if not, what a lot of us do today is, you know, the first thing we do when we wake up, right? And a lot of us are woken up by our phones as our alarm clock, is that the minute we pick up our phone, we see all the list of unreplied messages, unreplied emails, requests from bosses, and that's how we start our day. And we actually, now that we don't have to travel to work, while it may seem to help us gain time to work, gain productivity, in reality, what I have found is that it doesn't, because we have lost that short traveling time between office and work that actually serve as a healthy escapism. Because that traveling time allowed us to warm up to go to work. It allowed us to kind of plan our day a little bit. And importantly, at the end of the workday, it also allowed us to unwind and be away from our phones. But because we don't have that time, right? And you know, it can be as short as just 30 minutes in total to and fro. It forces us to just kind of immediately be expected to jumpstart our day from the minute that we wake up. And at the end of it, we don't have a clear, I guess, cutoff point, right? Or we don't have clear boundaries in terms of when has the workday ended. So with that comes the need to be a lot more intentional about how we plan out our days, right? Okay, this is my undisturbed 20 minutes in the morning. Even if technically I can just open my phone, open my laptop, right, and start working in my pajamas, I will not do that because that's not good for me, right? So I will go and do something else, right? Read gossip, you know, tend to your garden, right? That's what I do at least. But find this space where you can just gear yourself up to your workday, because then that gives you, I guess, more power and more endurance to kind of work through the entire day at work. But it really starts by first being intentional about how much time you want to carve out for yourself. Because all of us right now, I think, and I think it was also mentioned by Sonia earlier, work has become harder somehow, right? Even if it's supposed to be more flexible now that we can work from home, there's a lot of implicit expectations that comes, you know, all the way from how do I communicate with my bosses when it's virtual, right? How do I manage, how do I ask questions when I have a question about a task that I'm doing? because I don't know if my boss is available. I don't know if my colleague is available because I can't see what they're doing. So I feel the need to block time. But then people's calendars are full, right? So how do I go about doing that, right? So there's a lot of all this implicit expectation that is necessary in order for us to continue performing the same way that we have. But as a result of that, we just have a lot less time. So I would advise people really to kind of prioritize time management, right? And be super intentional about it by starting with how much time do I want for myself before every single workday.
Okay, thank you so much, Dr. Tiffanie. Moving on, since we do not have much time, Dato Aliyah, perhaps you can tell us, how do you bring awareness to companies on having a proactive employee engagement? Like you mentioned just now, an open conversation with your employees.
Thank you, Shida. I think this question has come up quite a lot in many talks with organizations, and bosses always want to know, how do I get my employees more engaged? When I talk about bosses, I'm not just referring to the owners of the company. I'm also talking about the immediate bosses, the head of departments, etc., right? The first thing that I would like to tell bosses, employees, and everyone out there is to understand and realize COVID just did not invade our bodies. COVID also exposed the cracks in the existing structures and accelerated change, and the need, for it to appear in the workplace is now very evident. So we need to understand that there were already maybe tiny cracks in your system. HR people would know the challenges in every organization. It's quite impossible that you have a 100% perfect working condition and an environment. And what has happened is, with all this, with the COVID and the situation that we were in, and of course we are now getting better. We have adapted, we have learned to adapt, we are forced to adapt with the changes, but nevertheless the cracks have only become bigger. So what we need to do now is to try and see, how do we bridge that gap, right? So when we talk about employee engagement, I use that example to tell the employees and the employers, if you want to bridge that, you got to get some sort of feedback. Now, how do we get feedback? The other problem is, employees still in Malaysia, we still have the stigma. If I say, you are going to think that something is wrong with me, I'm always the one complaining, you wouldn't like, you would judge me, and a lot of judgment goes on as well in an organization. So therefore, my encouragement is then to say, why can't you have group feedbacks where it's anonymous, right? You don't know, and I'm sure Ranjitha can attest to that, because when you do group feedbacks or you do anonymous feedbacks, you actually get a lot of value in terms of new ideas. What do employees want? Let's talk about that when we talk about engagement, right? If you give them what they want, they engage with you better. It's as simple as that. So can you give them what they want is via finding out what is it that they actually want. And if it's within reason, why not, right? But I think as a whole, when you do that exercise here, and you find out one way that by giving in to the employees, the other way is to also encourage employees to understand that we all now need to focus on the future. Okay, so we need to strive now to focus on the future. I tell everyone, stop talking about what happened 18 months ago, what happened 6 months ago, what happened. Yes, we do say, but we don't indulge in it because it has passed. So worrying about something that you cannot control is worthless. So why not look to the future? So when you talk about employee engagement, to be very proactive, get employees to sit down with their immediate superiors, their bosses, etc., departments, and talk and focus on the future and say, let's strive now to get there, right? The second link is race to reskill. Let's all race to reskill, because what's happened in the past few months is so many learning opportunities out there. Ranjitha talked about free talks. Luckily, she didn't mention our organizations between Dato, Andrew, and myself, because we've been asked to give so many free talks. And then when you pay, you go to Dr. Tiffanie, right? So the fact is
that's true.
Thank you. So when we talk about race to reskill, right? So let's race to reskill, because this is something new. We have learned now with so many courses, everything that we can go online, we can Google, we can find out, we can emerge with so many new things that we have all been learning, as despite the fact that probably we are leaders, we are still learning, so we reinvent, reskill, reshape. And I like, a lot of people like to use the word be agile. I will continue to tell you as a management person, please, I understand, yes, be agile, but please know where you're going. Don't be agile and not know where you're going. Right? People like to say, be agile, be agile, be agile. But please, I like to tell you, be agile to know where you're going. Otherwise, you're going nowhere. Okay? The third thing that I'd like to say very, very quickly is please see ahead to the needs of the future. Every organization have your own goals, vision, mission, what you want to reach, what you want. Now, it's just not for the organization. As an employee, don't forget, you are a person, you are an individual. You take care of yourself, and your good self will help to take care of the employer. So the employer and the company must understand, if my employee is in a good frame of mind, my employee has got her act together or his act together, that will contribute to the organization. And lastly, redesign the work experience, because things have changed, right? We all have been talking about the changes that you need to make, and Dr. Tiffanie gave you a very, very good example of redesigning the work experience of starting your day. It's as simple as that, right? Because we used to sing in the car when we drive, probably, right? We look out and now today, you know, it's straight from wake up, read the messages, quickly turn on the computer at 5 minutes to 8 or something before, because you have a call, right? So the competitive age, make that as an advantage rather than as a disadvantage. The competition is out there, but it can be made as an advantage, right? And have that desire to stay, right? Now, I want to leave, before I give it to Ranjitha and your next question, I want everyone to realize this. Now, we all invest differently. Now, when you invest money, for example, you invest money, you want the returns. You want to see your bank account having a little bit more money because you got the dividend, the payout. But my encouragement is to tell you, not just about the money. Also realize to get your employees, and everyone out there, to invest emotionally. When you are emotionally invested, you want to contribute. Right? So bosses and employers and companies can get employees to get themselves emotionally invested in the organization, the values, the beliefs, the goals, the support system, even a certain project, a program, right? Despite the fact that probably Dato Mohan has got so many other things, lecturing, everything, he's still with the foundation, and so am I. It's because we are emotionally invested. We don't get paid on our foundation, but we are emotionally invested in what we want to do. And therefore, here comes the free talks that people like Ranjitha will come after me after this, right? So I know, so emotionally invested, so you say yes. So get people emotionally invested. And I think definitely the employee engagement and the bond will be very much stronger.
Okay, thank you so much, Dato. Okay, moving on to Ranjitha, Head of Recruitment of Big Two Bazaar. Ranjitha, this is a 1 million question. Yeah, can you fire an employee with mental illness? You know, is employers allowed to fire mental health reasons for mental health reasons? Ranjitha, what is your take about that?
Well, to be honest, there's no law saying whether can or cannot be terminated, but there is. This is determined by the terms of the employment contract of the employer signed within the company. See, in the Section 10 of the Employment Act, it's indicate that employer must state condition under which service is terminated. So, in a contract of an employee, it may state that employer reserve a right to terminate employee under the grounds of what they call suffering from a mental or physical conditions that may affect the employee's performance at the work. It may happen. Termination might happen. But again, that's if, as Professor said just now, is there's a law or there is a legal boundaries that has been set up on this mental well-being or mental health, which we can help employee in this kind of situation, it'd be very great for us to look into this kind of law. There is no law, so that is
Can I just add very quickly something
Yes.
onto that? It's
Yeah, please do.
also the thing is it's sometimes I think employers use a different reason to dismiss employees, and that could be non-declaration of their mental health, or the fact that they're seeking treatment for mental health, and because they're afraid that they may not get the job, they don't declare that. And when the employees find out later, and if they feel that they need to get rid of the employee, then they say that you have not been honest with us, and therefore we have every grounds to get rid of you. You see, so it's a very tricky question here. The fact that the crux of the matter is that nobody seems to understand or appreciate the fact that that condition that that person has may not really have an impact on the job that they're doing.
Yeah.
That's one. And even if it had an impact on the job, then maybe if they sought appropriate treatment, then you will realize their full potential in the workplace without labeling them as somebody who has a mental illness and therefore cannot be in the workplace. So this is a bit of a chicken and egg situation here. And as I say, for strong company policies to be there, to be entrenched, I think there must be some kind of an ombudsman or some legislative changes that has to be brought out. All right, thank you.
Okay, all right. It seems that we are nearing to 12 o'clock. That's fine. We'd like to take some questions from the members of the floor. Let me take one. Do we have one? Let me just go down. How do we actually set a boundary between work and personal life when there are so many companies, WhatsApp group, and work-related WhatsApp groups with clients and colleagues? This relates to the next event, right, Ranjitha? There's an event that you organize. That can we exit our company's WhatsApp group? Okay.
Yes.
Perhaps Dr. Tiffanie or Dato Aliyah would like to take up this question.
Tiffanie, go ahead.
Okay,
Yeah,
doctor.
maybe I just go first, and this is a very good question, and I will admit that sometimes I struggle with it too. And the option of carrying two phones just doesn't work for me because I'm too absent-minded. But I think one advice that I often give is that people tend to have this cognitive bias where we expect other people to know that we don't like having WhatsApp groups that are work related. So what I often ask, whenever anyone talks to me about, I don't understand why my boss created this WhatsApp group. The first question I ask is, well, did you tell your boss that you don't like it, or that you would like your WhatsApp on your personal number to remain personal? And the answer is 90% of the time, no. So I think it does, yes, it's unpleasant, right? And yes, to a certain extent, we want our bosses or those around us to respect our boundaries. But we also have a role to play in just being courageous enough to voice out what our preferences are. Because if we don't do that, then it's also unfair to expect others to know how we feel, because some people are generally okay with it.
Okay, thank you so much, Doctor. Dato Aliyah, what do you suggest to sole proprietors working from home? The sole proprietor is the only soul of the company to strike a balance with the family who are also working and studying from home. Okay. All right.
Very, very quickly, just to add on to what Dr.
Can.
said, I'm one of those who belong to God knows how many umpteen WhatsApp.
Me too.
Right? So I will tell you this to everyone out there. The way I look at it is, WhatsApp means it's not urgent. If it's urgent, you would have called me. And you only call me when it's really, really urgent, meaning you're going to die, something really happened, somebody else died, something like that. So if you can define what's urgent and call me, then everything else has to wait because it's via WhatsApp. So wait, don't overstress yourself. The problem is not the group. The problem is the people who are in that group who take it on and believe that I need to reply every single WhatsApp within the 2-minute time frame, which you put, not anybody else said you have to reply fast. So you put that pressure on yourself. Now, coming back to your very quick question, which I actually took the liberty of answering in the box, but I would say it out again. I think to Sukdev, thank you for the question. I think we use the word boundaries. So when you work from home, you have limited amount of space. And as a sole proprietor, you are alone, right? So naturally, it's between with you and your business out there, whoever that you are speaking to, because you are a sole prop. So one thing that you must, people in your house, you must have the conversation with the people around you to say, look, this is my time to work, and you can actually tell them, I am having a very urgent call, 10 o'clock to 12 o'clock, or
Yeah.
2 o'clock to 3 o'clock. I really need you to be quiet, because if you don't tell, they don't look at the ceiling and assume that you are online or busy or having a conversation. So set the boundaries and say, this is my space, this is where I'm working from. Avoid that space, right? And don't keep moving every day, because people don't know, I mean, the world doesn't revolve around you. So I think people need to understand that. So have that space, okay? Lock the door if you can, if the space is in your own room, right? Otherwise, and if you have no choice but your place is very small, and if you are using the dining table, try not to make appointments. And because you are so prompt, so you actually try and get that appointments, try and make the appointments in an off-peak time, like probably 3 o'clock to 4 o'clock where everybody is resting. Don't go and do 1 o'clock to 2 o'clock when it's lunchtime. One cari pasal.
Can.
So I think adjust boundaries and adjusting, and create that space where you can inform people, this is my safe space, I need to work in this space.
Okay, thank you so much, Dato. Okay, I wish to take up this. I have to wear my glasses. All right. If you are responding to my question, I would like to remain anonymous to the public. I am going through a lot from being a single mom for almost 21 years, raising my two children with different personality skills, further my studies and completed my degree and MBA, being the sole breadwinner for the household of 8 packs, including my parents and nephew, and really embrace it on my way that I know. The awareness of how to get help, how to reach out for people like me, to branch out my sadness, sorrow, disappointment, stress, etc., be it due to work or personal, is not wide enough, as I'm still not really sure whether what's going on inside my mind, what I feel, are indeed an issue of mental health, and still afraid and not knowing how to reach out. Okay, darling, I'm here for you. If you need my number, you can just call me up. Perhaps we can have Dato, Doctor, and Dato Aliyah, and even Ranjitha to say something with this anonymous lady here. Dato.
Yeah, all I just wanted to say is, I mean, given from that little bit of information that we have from this lady, clearly she's in great deal of pain, and it is only appropriate that she reaches out to get the necessary help. Now that help might not be might be multi-layered or multi-leveled kind of a help, in the sense that she may not be in a position to go knocking at the door of a mental health professional straight away, but she could, if she wanted to, and I'm not sure what her situation is, but she could reach out to us, to any of the helplines that are there. For example, in MMHA, if she reaches out to us, what we do normally is whoever who mans the helpline will then be able to assess, make a very brief assessment of the situation, and then guide her to seek the respective professional help, whether it's from a clinical psychologist, psychiatrist, or a certified counselor. That will also, we also take into consideration her financial situation, and we might be able to guide her accordingly. But one thing is sure, from what you tell me, I think you really need support now.
Yeah. What about Dr. Tiffanie? How can Naluri help her? We should be able to.
Yeah, I think just like what you said, Sudha, I'm also personally here for you, right? I think download our Naluri app, because I think it's exactly, situations like yours that it is our reason for existence, right? We appreciate that, especially in Malaysia. I think in developing country in general, it is even harder sometimes for women to reach out for help. And thinking about, oh, I have to book a 1-hour session with a therapist, it's very daunting, right? And you also have to kind of manage a lot of logistical challenges sometimes just to go for your appointment, and you have to match the availabilities of your time and the therapist's time. So do download the Naluri app, right? And I think this is where we wanted to provide this safe space where people can just talk to a professional on the phone. And it's asynchronous, just like WhatsApp, where if you're online and your therapist is online, you'll be able to have a live conversation. But then if not, your therapist will reply you once he or she comes back online, right? So then that gives you the safe kind of privacy to then speak to someone. And then based on that, then at least you will firstly have someone that you can trust and is objective in listening to what you're going through. But then secondly, also then help you kind of come up with a plan in terms of what is the best next step. Because like what Dr. Andrew mentioned, right, it could be to speak to a clinical psychologist. It could be that you need psychiatric help, or maybe all you need is just a friend through a registered counselor who will speak to you on a regular basis.
Okay, thank you, Dr. Dato. I would love to listen to your soothing words and encouragement to her. Perhaps.
Well, firstly, I want to congratulate and say thank you for reaching out, because the fact that you know you need help is the first major step you have taken, and I think we want to say good on that, taking that first step. And secondly, please know and understand that there are so many people out there who are ready to help. I think that is one good encouragement, that you should know somewhere, somehow, even over here, there are 5 of us already with our organizations all behind you. So just reach out to and see where you resonate most, where you're most comfortable with. Even if you start as with a counselor and then take it from there. I think the steps are very, very clear by Dr. Andrew, so I won't go into the steps. But know that there is a lot of help available for you. And now your next step is to go get that help. Reach out.
All right, thank you so much, Dato. What about Ranjitha? You have any kind and soothing words to her?
As everybody says, it's time for you to reach out and get help. Find a person, talk to a person. If you can't reach out the expert first, if you're comfortable with anybody, maybe a family member or your colleagues or your close, reach out to them first, talk to them, and then maybe they can help you to link to professionals, NGOs, experts. We have experts here as well. You can reach out to Professor, you can reach out to Dr. Aliyah or Dr. Tiffanie. All of them are here to help. Reach out, ask for support, talk to people.
Okay, thank you so much, Ranjitha. Okay, I'm afraid that's all we have for this session. I'm also, I think we already overrun a bit, about 10 minutes. That's all right. Thank you so much for the questions. If you wish to post any questions, you can comment in the chat box either in Facebook or LinkedIn. We can have our next session perhaps in another platform with esteemed panelists for today. Ladies and gentlemen, that's the end of our online forum or online webinar. I love it so much for today. Thank you so much. Take care and stay safe. I'll pass the baton to MC Stephen. Stephen, thank you so much.
Thank you, Shilda. Thank you, Dr. Andrew. Thank you, Dato Aliyah. Thank you, Dr. Tiffanie and Ranjitha. That was very illuminating. I'm sure many of our viewers also picked up a lot of good information there. If you have enjoyed this talk, please consider signing up for Employment Law Conference on December 13 and 14. We have over 30 distinguished moderators and speakers to discuss and share their views on various recent and interesting developments in employment laws in Malaysia and abroad. The conference is also HRDF claimable, and to sweeten the deal just for today, participants can enjoy a 10% discount of the conference fee. So do hurry, however, this special offer is valid until December 3rd. The promo code is ELCMH10. I repeat, ELCMH10. We'll post it up on our L2 Icon Facebook and LinkedIn page. You can read there as well. And also, yes, as Shilda mentioned, and also the question from the floor earlier about you're in too many WhatsApp groups. Well, we have a talk just on that, and it's free. It's titled Company's WhatsApp group. Can I exit? So you join us for our LinkedIn and Facebook page to stay tuned on our future events and programs. Thank you once again for joining us. Have a pleasant weekend. And with that, I will end with the trailer for Employment Law Conference.
Well, Azlan, it seems like you haven't really come to terms with being back to office after working from home for quite some time.
What office? What home? Irfan, I can hear you. What? No, man, I still can't hear you. Are you okay? I'm right here. No, you are probably on mute. Huh? Okay. So you need to click join audio. I'm right here. It's in the bottom left corner of your screen. Right here. I'm right here. I still can't hear you, man. Sorry. Can you hear me now? It's in the bottom left corner. Irfan, I can see you either now.
You're not on Zoom anymore. Those days are over. And why do you bring your laptop to the washroom?
That never happened. Whoever told you that, there must be a lie.
That was me who saw it. And your colleagues are telling me that when they come to your room, you just yell at them?
Yeah. Yeah, I know. I know what do they mean.
Azlan,
Yeah.
there's something wrong with the printer. Could you have a look at it, please?
Okay. Hold on for a second. Yeah. I don't give a damn with your printer. Do you think I care about it? Your printer, huh?
Yeah.
And one more thing, Aslan. Were you wearing a short during the team meeting?
Two will be. Oh, I have a call, guys. Sorry. Okay, hold on for a second. Hello. Yeah. Sorry.
You are not at home anymore. Seriously.
But why? Why can't we work like how we used to work from home?
It is how it is, Aslan. You have to be patient, and in general, you have to be more polite to people who... Aslan?